Welcome everyone to our Future Physician Leaders presentation by our fabulous group presenting Living Our Breast Lives. Presenters are Charita Guedela, Alicia Nguyen, Maya Bello, Jasmine Garcia, Lizeth Tinoco, and Ola Ayesh. So I'm going to pass this on to the group and let them begin their presentation. I do want to thank Health Services for helping sponsor this event for our students, as well as Norco College STEM Club, Engineering Pathways, and of course, UC Riverside's School of Medicine. So carry on, group, and show us your presentation.
Yes, thank you very much, Patricia. I'll be sharing my screen. Okay, can everyone, if we can have like a thumbs up in the chat, to see if you can see my screen or not. Or if anyone can just shout out saying that they can see the screen. Perfect. Okay, well, hello everyone. My name is Charita Guedela. Thank you for coming here and being able to listen to our presentation. Our community health topic is breast cancer, and let's just dive into living my breast life. And as I said, my name is Charita Guedela. I am going to be a fourth year bio major at UCR. Passing it on to Alicia.
Hello, I'm Alicia, and I'm going to be a second-year cellular, molecular, and developmental biology major at UCR. Passing it on to Jasmine.
Hi, my name is Jasmine. I'm going to be an incoming second year, and I'm doing psychology at UCR.
Hi, my name is Maya. I am a fourth year psychology major at UCR.
Hi, I'm Ola. I was on mute. I graduated with my BA in psychology, and I'm going back to school for pre-med.
Hi, everybody. My name is Lizeth Tinoco. I'm going to be a fourth year at UCR. I'm majoring in biology.
So here's a quick disclaimer just to let you guys know that we are not licensed medical professionals. So anything that you do learn through our presentation, we still recommend that you reach out to your physicians. This is just for educational and informative purposes only. Here we have our pre-survey, which was created to test your knowledge before our presentation. It should only take a few minutes to complete, and I'm going to paste the link in the chat also for those who don't want to scan it. But we really appreciate if you guys can fill this out for us. It's only going to help us gather important data that we need at the end of our project. So we'll give you guys a couple minutes to do that.
And we just want to let you know that we are asking for your name, first name, and please put your last initial also, just so that we won't, get the data messed up. Another thing is that the names will not go anywhere. So it's like very confidential. Just wanted to let you know.
And if you guys don't want to use your names, you can always use like a nickname, an alias, anything just to help us match pre and post surveys.
I hope everyone's day is going well. Excited for the weekend, anyone?
Very much so.
I am.
I am excited.
Yes. How was your day, Patricia?
It's busy as usual here at Norco College. Thank you for asking.
Patricia's always busy.
Even in your busy schedule, you were replying to our emails and everything. So thank you so much for that.
Oh, you're most welcome. You guys are a pleasure. And this is a fantastic program for you to be involved in. So I'm really excited to have you all here, as I'm sure our students are anxious to learn everything that you have learned about, being in this program. It's really a great opportunity, especially if you plan to pursue a field in medicine, a career in medicine. This will definitely get your feet wet to see if, you really are, that's where you're supposed to be. So I love the fact that this program has been around for such a long time. And Dr. Ruiz, who started this program, has really drawn attention to young people in the area from all areas, high school, all the way through graduate school, to participate in this. So it's a great way for students to collaborate, get to know each other, network, and work on something meaningful to share with the community partners. So I applaud you all for all your hard work, and I'm excited to hear what you guys have planned for us.
Thank you so much, Patricia, for that. And yeah.
Thank you, Patricia.
And we were wondering, does anyone else need any more time regarding the pre-survey?
Thank you, Michelle, for letting us know you're done.
Yeah, give me about 30 seconds.
Okay, so we'll move on to the next slide. So some objectives and goals we have for you today is to mainly understand what breast cancer is, some preventative measures you can take so that you won't contract breast cancer, and identifying risks of breast cancer, and also see some resources that are available in the Riverside, San Bernardino, and even for the whole state of California, just regarding breast cancer. Now, if we go to the next slide, we can see the prevalence of breast cancer. Not many people know, but breast cancer is actually related to your ethnic background. So if you do identify as white or Black, you do have a higher chance of getting breast cancer, especially in whites and Blacks, and followed by Asians and then Latinos. And not many people think that men do not get breast cancer, but that is a huge misconception. Men do get breast cancer, and it's actually identified in their later stages because not many people know that men can actually get breast cancer. So even though there's a less than 1% risk, where 1 in 833 men tend to get breast cancer. On the other hand, women do have much higher risk of 13%, where 1 in 8 women tend to get breast cancer in their lifetimes.
So here's a diagram of the breast, and this is important because these cells make up tissues, and when the cell cycle becomes unregulated, it causes a tumor within the tissues. And some additional information I thought would be important to add is that the lobules produce the milk, and the passages will transport the milk. And in addition to that, the fatty and connective tissues that the tumors can develop in help support the breast. And next slide, please. So what is breast cancer? As I mentioned before, it's caused when the cell cycle becomes unregulated and the cells start to divide uncontrollably, and which then leads to a tumor to develop within the tissue, leading to cancer.
So when left untreated, breast cancer is going to progress, and this kind of gives us a closer look into how that progression occurs. Stage 0 uses a term in situ, which means in the place of origin or the place where it began, and details how the cancer has started but has not yet spread from this area. Stage 1 similarly can be found in this general area, but now it has broken free and can attack the surrounding healthy tissue. Stage 2 gets a bit tricky because the cancer has different levels of severity in the way it grows and spreads. Stage 3 is now considered an advanced form of the cancer and is harder to fight due to the extent it has gone. And lastly, stage 4 uses a term metastatic to describe how the cancer has now invaded vital organs, but is considered deadly because it's hard to rid the body of the cancer in all areas that it has traveled.
Okay, so knowing some of the symptoms of breast cancer can make it easier to identify it. Some symptoms to look out for are lumps in or around the breast area, pain, changes in texture of the breast, discharge, nipple inversion, lymph nodes, dimpling and redness, as well as swelling of the area. Next slide, please.
So as mentioned before, yes, men can get breast cancer, but being a female will automatically increase this risk. Also, having a family history of containing the breast cancer genetic mutation gene increases this risk. And as for age, the older a person is, the more likely they are to get breast cancer. Consuming alcohol and being obese after menopause also increase the overall risk. And lastly, radiation exposure done in the chest area at a younger age to treat other forms of cancer also increases this risk.
So in order to be diagnosed with breast cancer, a physician typically has their patient undergo an MRI, a breast ultrasound, and or a diagnostic mammogram to scan the tissue of the breast, just to search for any abnormal growths. Next slide, please. So stigma is a significant barrier to the uptake of screening, diagnostic services, and engagement in care for women and men with breast cancer. So delay in care can occur due to the fear or lack of trust of a physician, or lack of physician recommendation of to get breast screenings. And another barrier could be the lack of knowledge to what breast cancer actually is. And included within these barriers are the minority populations. Next slide, please.
There are several treatments for breast cancer. There's surgery, which is the removal of the tumor and some surrounding healthy tissues. There's radiation therapy, which uses high energy X-rays to destroy cancer cells. There's chemotherapy, which uses drugs to destroy cancer cells. There's hormonal therapy, which blocks hormones from attaching to receptors on cancer cells. Lastly, there's biological therapy, which uses the body's immune system to attack cancer cells. Next slide, please. Okay, now how can we lower the risk of breast cancer? Prevention is very important. According to research, one of the things you can do is get your annual mammogram. Be vigilant about checking for any changes in your breast. Basically, check your breast all the time, stalk your breast. You have to check for any changes. It's very important. If you can breastfeed, because what breastfeeding does is sheds breast tissue, which helps potentially remove cells with DNA damage. And just like prevention for other cancers, a healthy diet, maintaining a healthy weight, and exercising is extremely important. Limiting your alcohol intake. I understand everybody wants a drink here and there. Just limit your intake. And smoking can also increase the risks. Also, limit using hormonal medication, because what that does is high levels of estrogen relates to breast cancer. So consult your doctor in the end and let them know what is the best approach for you.
So many questions can be of concern when it comes to breast cancer. So however, when you go to an appointment with the doctor, you have to be it's important to be prepared with the appropriate information to be comfortable and confident about your health. So some of the questions include, what is the stage of my cancer? Are there any limits on what I can do? What are my treatment options? What is the chance of reoccurrence? So as we saw throughout the presentation, cancer can progress and have different stages. There are a couple of treatment options where one may be limited to certain activities during treatment. And once treatment is finished, there can be instances where breast cancer can occur again. So these are just some examples on what to ask your doctor, but just remembering to never be afraid to take notes and ask for any clarification when you don't understand something during a doctor's appointment is important, because your health really matters.
So here are some resources that we have in the Inland Empire, specifically Riverside and San Bernardino counties. The first one we have is the Pink Ribbon Place. This is specifically in the Riverside County. And as we did discuss in the slide before, one of the treatments for breast cancer is chemotherapy. And with chemotherapy, you do become weak, you do lose a lot of hair. So they do provide, for example, wigs or any other support things that we would probably need. The next resource is the Every Woman Counts program. And this is not just for the Riverside or San Bernardino Inland Empire. This is for the whole state of California. And they're just trying to push, trying to get financial assistance for treatment for the people who have been diagnosed with breast cancer and for people who meet their requirements. They also have a 24/7 assistance available at this number below. Please scan these QR codes. And it's a great opportunity to learn more about them. The next one is Breast Cancer Solutions, which is in both the Riverside and San Bernardino counties. And this provides financial assistance for treatment similar to the Every Woman Counts program, but this is more locally involved. The next one we have is how to do a self-breast examination video. And this is actually a YouTube video, and it's created by a well-known institution just to know how to do a self-breast examination, because many people think that when you're doing a self-breast examination, you only need to look for any symptoms or redness and swelling, but you do also need to feel around the breast in order for you to see any signs of changing in your breast tissue or anything like that, to see any lumps or anything. So I'll give you about 20 seconds to just like scan the QR, about half a minute to scan the QR code. Meanwhile, we are going to be putting these in the chat. So we'll also look out for that. But do you all have any questions so far about the resources or any of like anything on the slide as of now?
I have a question, everyone. And perhaps this isn't like the most like well thought out question, but where did you come upon these resources, and what made you decide these four in particular?
So personally, what we really wanted to do, one of the most important things is actually trying to be able to ask for help regarding like the assistance program. So the first thing that I really liked about, for example, the Every Woman Counts program is that it's a state program. It's not just for one localized thing. And it also has a 24/7 assistance call line, which not many places have. Many places do have their like time that they don't answer phone calls, but this is 24/7. The next one is the Breast Cancer Solutions, which I really liked because it takes place in both Riverside and San Bernardino. And I liked how it's more intimate, more smaller, because it's specifically focusing on these two counties. And the Pink Ribbon Place has been in the Riverside County for a really long time. And even though we have provided resources for financial assistance, anything like that, the Pink Ribbon Place really ties in the community better, which is what I felt whenever I call them, or like the assistance that they have. Lastly, did you also ask about the self-breast examination video, how I came with that? Patricia?
Yeah, that would be great. To just, I didn't know that they had something like that on YouTube. So wow, that's great.
Yeah, so there were actually many there were many videos, but what really appealed to me is that it's actually coming from a physician who is making the video from an institution, which I found was a very beneficial, because many people can say, okay, this is wrong for you, like eating a certain food is wrong for you. But if you take that same statement, and if you hear it from like a person who's qualified to say it, people take it more seriously and differently. So that's how we came up with this QR code for the YouTube video.
That's great. Thank you for the links. That's awesome.
Thank you. And I see we do have them in the chat. Thank you, Maya, for putting them in. And as for the next slide, this is the post survey. So if you guys can take out your phones, that's also going to be added in the chat, which Maya did. Thank you, Maya. And yeah, we'll give you about 2 minutes to just finish the post survey.
If anybody has any questions, please don't be shy to ask. We would love to answer any of your questions.
And if you have any questions regarding the post survey, like maybe how to even approach a doctor or anything, we're like available to answer even those questions.
I have a question for y'all. Breast cancer runs in my family, so I'm acutely aware of what happens to someone and the treatment process. I know it's different for every individual. My oldest sister is a breast cancer survivor. She's been in remission for about 7 years now. It is quite an ordeal to see someone, your loved one, go through that ordeal. And along that line, what made you all choose this particular subject?
Personally, for me, I have some distant family members that have struggled with breast cancer. So when this topic came up, I was kind of really excited to go into it to kind of understand more what they were going through and just to learn more about it in general. But I feel like as an all-female group, we all decided we wanted to do women's health, and breast cancer was very important to each one of us.
And personally, oh, are you done, Jasmine? Or okay. Personally, for me, when I was looking at the statistics, Riverside, San Bernardino counties have a lot of breast cancer incidents compared to other counties in California. So that is something that we really tried hard to actually spread the word in the community, just to like try to emphasize how important breast cancer is. And we just hope that even like a small amount can be reached out to people, and they can definitely like learn from this presentation that it's really common in the Riverside and San Bernardino counties. And many people don't even know that, for example, men even get breast cancer, for suppose. So that was my driving force.
Thank you, Terry. I'm sorry, go ahead.
Oh, my bad. My driving force, I would say, is probably because I have a family history of breast cancer, and I'm actually a hypochondriac. So if I get a cut on my leg, I think I'm dying. Or if I'm a Google doctor, I got my MD from Google. So I go online and I believe that I know everything. And then as soon as I look up one thing, I think I'm dying. So I think it was important for me to step outside of my comfort zone, even though cancer and things like that terrify me. So this is kind of a learning opportunity for me as well. So that was big for me.
That's great. Thank you for sharing that, Maya, because I'm right there with you, looking at everything when someone is in the family is ill. It's like, okay, I got to look that up. I have to figure out, what if they're dispensed some sort of medicine. I want to make sure I know all of the side effects and everything. So I'm right there with you. I agree. Sometimes you have to educate yourself so that you feel more confident in your own health and your own well-being, and that's really important, to feel at ease when, not just when you're going to the doctor, but when you're going through any kind of medical I think it's, even if you're going through the flu or breast cancer, it's important to be aware of all of the areas that can befall you or your loved one. And I'm glad so much that Tarita, you touched on men with breast cancer, because most men don't feel like they're susceptible to breast cancer. But I have a very close friend who is in stage 4 of breast cancer, and he's survived treatment for the past 4 years, but it's taken a toll on his body, and he's an older gentleman. So it can happen to men. So I'm curious if your YouTube video that you shared the link for, is that for men as well as women?
So because because our group is females mostly, the video that we shared actually shows like how a female gets like lumps in her breast or like any symptoms. So I guess, but even men can also get lumps. So we kind of saw it in that perspective.
Thank you. I really feel how it's important that it's known as not just a woman's disease.
And it's more In a way, it's actually more detrimental to men because they really, many men, when we were talking, presenting in the community, we were asking like specific males, like, okay, would you like to listen to our presentation on breast cancer? And they were specifically saying, I'm a man, I won't get breast cancer. And I said, there is a chance, like, knock on wood, like, God forbid that won't we really hope that won't happen, but there actually is a chance, there is a risk associated. So we were really trying to tell people about that, trying to spread that word.
It's very true, and it's so challenging when, I know when our close friend, the family, when he was having these health issues, and finally his physician said, I'm going to do an MRI finally. And when they did that, they discovered the cancer, and it was breast cancer. And he thought it was some other type of cancer, but when they told him it was breast cancer, he's like astounded. He's like, you got to be kidding me, no, we're not kidding. Men can get breast cancer, and it's a very real disease for men, and they need to be just as diligent as we women in protecting their own health. So
Yes.
thank you for sharing all that information. I'm sure there are other questions. I would hope that, everyone feels comfortable in asking those questions. We have a great group here, so go for it, everyone.
Feel free to put it in the chat. If you won't be able to speak, or if your microphone's not working, yeah, and we'll just like also read the chat if anyone wants to contribute.
I also wanted to add something. So something that we found was that the risk factors involved, where there's mostly Latinas or Latinos getting breast cancer, it's not really due to their health history, but their lack of access to resources. So throughout our presentations, we wanted to emphasize the resources that we provided and then help educate them on the symptoms and when they should get checked out for their symptoms.
Yes, and not many people know this, but Riverside Free Clinic also is a resource where they do provide free mammograms. And we don't know which day it is specifically, but if you definitely call their office, they do provide specific mammograms and for people who need it. So that's also a great resource, and it's partnered up with UCR School of Medicine. And
we really wanted to normalize men and women checking like their breasts. Like, so this topic was really important to us, and we wanted, like, we didn't want anyone to be shy about it or embarrassed about it. We just wanted to put it out in the open that it's okay to go get checked, because I know so many people, like in my family, they would wait until they're like 60 to get a mammogram. They would keep avoiding it because it's uncomfortable. But like, there's nothing wrong with it. There's nothing wrong with checking your breast. There's nothing wrong with, like, watching a video, checking your breast on your own. So we wanted so badly just to spread the word and just normalize it. Just wanted to put my 2 cents.
Thank you for that. It's important to educate ourselves, at every level and stage, our age, especially. When you mentioned that, when you shared that it happens to most women who are postmenopausal, and the other effects, if you want to go back to that slide, I think that's really important. It can happen at any stage in your life, but for women that are over a certain age, and I know a lot of women my age tend to feel like, wow, thanks, another thing that you got to add to my age level. But it's really important, to be aware of the risks that you face because you're at a certain age, because of your health situation. So it's really important for us as men and women to take the best care of ourselves. We only have one body, and want to make sure that we live our best life, not just our breast life.
And there was this one question in the chat, like, why is breast cancer more prominent in certain races? For that, I think it's just the genetic makeup in that certain way. Also, also a certain population, like the lifestyle choices that you make, as Patricia said, which is very important, like you really need to take care of your body. So yeah, that's a big thing too.
And also how Alicia said that some, specific groups have a lack of resources because of their belonging to said group.
Yes, agree.
Thank you. Questions. We welcome more questions. We can take it. Come on.
Alicia, I have a question. It may not be entirely appropriate, I apologize, but you explained how tumors grow in the female breast, right? So can you tell me very quickly which part of the tissue? It's like the lobules or the milk ducts, am I understanding right?
It's in the connective and the fatty tissues.
Okay, so is that the same type of tissue that the male breast has? I was just wondering, like anatomically, if there was the same tissue or if the men's breast cancer developed in a different type of tissue.
Ola, do you have an answer to that?
As far as I know, and again, we're not doctors. As far as I know, is that yeah, that's the same in men. The connective tissue,
Okay. For some reason, I was stuck on like the milk producing glands, and I just kind of couldn't get my mind off of it. But maybe it'll help somebody with a male relative. So I just wanted to go ahead and ask. Thanks, though, ladies. I appreciate it.
Also, like for the milk glands, like we also said that while you're breastfeeding, like it reduces your chances of breast cancer because your milk, when you produce the milk, you shed cells, and those cells in your cells, there's like a certain percentage of cells that could be susceptible to being to mutating incorrectly or developing into cancerous cells. So as you shed them, it decreases your chances of breast cancer.
Yeah, it removes like this DNA damage in it. So that's why if you can't, we understand that not everyone can breastfeed, but if you can, go for it. It helps you in the long run.
Got it. Thanks.
We were wondering, has everyone finished the post survey? Because we didn't get anything in the chat, so we just wanted to make sure. Oh, we're getting something in the chat. Okay, we got yes. Okay, sounds good. And there's one more link to our social media brochure. And our YouTube video link is also, our YouTube video page name is also right here. Please also follow us on Instagram, but this QR code is just for our brochure. So it'd be great if you can take a look, just keep it in your phone all the time if you ever want to look at any resources. And it actually coincides with our YouTube video. So please take a look at it.
I have another question. Can you all go back to the slide where you're showing the different stages? Right there. My question is that when you're looking and when you're doing your self-exam, did you all find in doing this research that those lumps can be found in different parts of the area, not just confined to the breast area?
So for me, it's still a little confusing only because I feel like because we have ducts and muscles and certain things, the breast is going to be lumpy anyway. So I'm still trying to figure out the difference, but I think that there was one of the slides we did have mentioned how there can be like lumps or hard knots in the armpit area under the arm, somewhere around there. I know that there's some that can be found. Some can also be hidden pretty well where someone may feel it and then the next person may not, and it may require certain testing. But I feel like it can be found in different areas. It really just depends on the person.
What I saw is that it's mostly in the breast area, so like around the armpit right here, and it even goes down to your rib area. So you kind of just have to, like, when you're doing a breast examination, just have to check the entire area.
And
Oh, I'm so sorry.
that's all good.
Also, like, it depends. Like, breast cancer is developed in breast, but it does spread. So it can spread in your lymph nodes. It can spread in your liver. It can spread in your lungs. That's just when it spreads, but it's still like breast cancer. So I hope that answers your question.
And there is one more thing I wanted to add. At the end of the day, you know your body the best. And certainly, if you feel a lump that's like consistently there, like sometimes it's not even a lump, like we probably just feel it. But if you find something that's different and something that you notice, that's when you should probably actually call and like go see a doctor. Another thing is that many at times we also see breast pain as a symptom for your time of the month, like when you get your period and stuff. So you really need to like know your body and just like take the time to actually like, do your regular breast examinations, because that's when you will really know.
I'm glad you pointed that out because, when I think we as women go through different hormonal stages in our lives. So like our cycle will change, so will, you'll feel more, at least I did. I felt more changes in when I would do my exam, depending on some of the foods that I ate, my time of the month, my stress level. So being acutely aware, you're very smart, and to share that information is acutely aware of your own body. You know your body best. You know your body better than the doctor does. So I really feel strongly that if you feel something, a pain, a lump, a change, something different, you're going to see it before anybody else does. And that's important to not only have that self-awareness, but to take care of it immediately, because it can spread rather rapidly. It did with my sister. She felt one lump, and by the time she decided to go to the doctor, there were 5, and 2 of them were in her lymph nodes, so that she had to have them removed. Luckily, she was wise enough to get it taken care of early and not wait, because it can spread rapidly just depending on, I think it's different with every woman, but she is doing great these days and is taking much better care of herself. So it's important. Our self-care is very, very important, and I really thank you all for bringing that to our attention, that being aware of how our own bodies react to ourselves, as well as being educated and knowing what those changes can be, is just very enlightening. And hopefully it'll help each and every one of you, including our young men, to identify, hey, this could be happening to me, and what to do and where to find those resources. Great presentation, ladies. I applaud you for all your research. If there's any other questions, I would encourage you all to share those in the chat with our presenters. They have done a wonderful job of giving this great presentation and resources for you to look further into. So go for it. We have about 20 minutes left for a Q&A, so go for it.
I have one more thing to add. I believe it was brought to our attention in one of our past presentations that one of their lumps was misdiagnosed, and they were the type of person to get every single lump checked out. So I just think that it's nothing to be ashamed of. I'm the type of person, like I said, I'm hypochondriac. So anything I feel, I'm going straight to the doctor every time. I will never miss a time to go to the doctor. So I just think it's important to check them all. Even if you're not sure, just check, because there's no harm in doing so.
And we would also like to point out some credits. First of all, thank you to the whole Future Physicians team. Thank you for Norco College for having us over. We would really like to thank Esmeralda Trejo, who's the whole director for FPL at the moment, our facilitator, Emery Lore. The intern we have is Nisha Cambo, and George Gu is our med student who kind of overlooked like our presentations, gave great feedback on whatever we had on our slides, seeing if it's accurate or not. So I think these 4 people are super important in whatever like the presentation that we did. They really are our like backbone.
Thank you. I know how hard Esmeralda works, so tribute to her. You guys did everything so beautifully today. Any last questions for our group? I know they are just really anxious to help you, so please share any questions that you may have, in either whether in the chat or unmute your mics.
Yes, of course, Alexis. Thank you. Thank you for attending.
Thank you so much, everyone. We appreciate all your questions. We appreciate you all for taking the time to come to our presentation.
Yes, thank you very much. And thank you, Patricia, for having us over. It's a great collaboration with Norco College. And we hope to do another one in the future too.
Oh, my pleasure. Thank you so much. And I'm so sorry that Cherie Summers was not available to come to your presentation today. She's our health services specialist here in our health services department. She's done a fantastic job in sharing, really critical information regarding overall health for students. So I would hope for future presentations that you also contact her as well. You guys always do such a wonderful, wonderful job. So I applaud you and your efforts. I wish you the very, very best in your career endeavors and your future education. You've done a fantastic job here. And, I just know that your symposium at the end of this internship is just going to be fabulous. Good job, everyone.
And also one more thing I forgot to add, because Lizeth put it in the chat. Courtesy of Alicia, one of our group leaders, we actually now have a website/blog where people can go, and it's a safe space to share stories, share pictures, any kind of thing you want to put on there. So I'm going to put that link in the chat.
Oh, that's fabulous. Thank you so much. That's a beautiful thing to share. I love it. Okay, ladies, well, if there are no other questions and you have no other information to add to our chat and for us to go on to, I really am excited and I want to thank you for sharing today. And anytime that you need to share another presentation, please contact us and let us know. Our students definitely can learn from you. One very last thing I would like y'all to kind of just sum up, because I know some of our students here have not been involved in FPL. Can you share just like briefly what it's been for you to participate in this program and how community college students can actually take part in this? I think that it'd be really vital information for them to know.
I'll share on it. For me, it's been pretty rewarding. I am a pre-med student and I do hope to go into the medical field pretty soon. So I think just expanding my overall knowledge in all areas of medicine is good. And to be able to get my foot in the door was really important for me. Being a pre-med student, it's really important to network and find opportunities like this. So this is one of the opportunities I knew I had to get into. And just overall, it's been a great experience. I've lucked out. I have a really good team. We all work really well together. And I'm a community college student. I'm transferring this fall, but when I signed up, I was a community college student. So I think it's just a great opportunity. I even think there's some high school students in it this term or this time around. So I just think it's a really good thing to get into.
Thank you, Maya. That's great. I know that there are several community college students that I've encouraged to go into FPL. So I like to hear, that feedback so that they can share that with our own current students. because it's really, really important for you to get as many experiences as possible while you're pursuing a medical career, because it is a challenge. You know, it is one of the most rewarding careers to immerse yourself into, but it is definitely a challenge. So I commend each of you for pursuing that and helping the community to learn more about, you know, their own personal health.
I owe you big time, Patricia, for introducing me to FPL. And I am a community college student, so thank you so much. It's taught me and tested me a lot about unity and leadership. And it's a lot of work. I won't like sugarcoat it. It's a lot of work, but you know what? Like when you work with a group like mine, you just enjoy it more, you know? So thank you, Patricia, and thank you to my group. Be the best. So it's FBL has really changed everything. Like I love it, and it makes me want to pursue medicine even more now. So thank you.
Awesome. Thank you so much. I love hearing messages like that, because you are our future. You know, when I go to the doctor in, 10 years, it could be you that I'm going to be, that's going to be my physician. And I would be like, I knew you back when. This is awesome. So thank you again, ladies, for sharing this really great information. I can't thank you enough for being our presenters here today. I wish you the very best, and in your future, and as well as in your education. Have a wonderful, wonderful day.
Thank you.
And I'll share the link for your recording so that you guys have it for future presentations. Okay.
Oh, thank you.
Oh, you're welcome. Take care.
Thank you.
Thank you so much.
Thank you, everyone. Bye.
Bye.